Okay. Well, I am delighted to be here, and I am grateful to the Planning Committee, and also wanted to give a special shout out to Erin and the Clean Air Coalition, because I have been, when I heard Erin speak at the EPA workshop that she mentioned, I was just blown away by the work that she was doing and the partnerships she developed. So I've continued to follow this and most recently read the annual report she sent, and it really is terribly impressive work. So I'm very excited that I will be learning more the rest of today with all of you. I wanted to start, though, by taking a step back. For those of you who are not yet true believers in community-engaged research or who don't know much about it, this cartoon I love because to me it really captures a lot of the problems that we face. We outside academics often get frustrated at the limitations of our traditional research approaches, the top-down approaches for studying and addressing issues that really matter in communities. And communities are calling us on this, and funders are calling us on this. And they're talking about what they see as a big disconnect between the things we worry about and work on and the real concerns of people in their communities. Which isn't to say that our ideas aren't important, but if there's a way we can connect them better with what communities are concerned about, we will end up doing a much better job. Community-engaged research, this is the shortest definition I could find, and it's a reasonably good one. I do like that it emphasizes that this is systematic inquiry. It's not the wishy-washy stuff that doesn't really count when you're going to try to impress people with the importance of the work that's being done, but it is done fully with the collaboration of people, community partners, and other stakeholders who are involved at every stage, and it's being done for a purpose other than just generating knowledge. We really do want to use the results, translate them, and use them in ways that can help bring about change. Now, many people have come up with principles of CBPR. I used today the list by O'Fallon and Deary, and I think that this is a very good list in capturing the essence of this approach with the emphasis on disseminating results in useful terms, ensuring that the interventions are culturally appropriate, balancing research and action. But there's one thing it misses that I also think is very important, and that's the idea of cultural humility. The idea that we can't ever be competent in another's culture, but we can show an openness to really reflecting on our own biases and kind of getting in touch with where we're coming from. And this can be as an academic. This is not strictly about race, ethnicity, but about position, power, privilege, all the things we bring to a situation. And in that space, to then be able to redress some of the power imbalances that exist and develop truly authentic partnerships. Using or coming in with cultural humility is absolutely essential. As all of you know, there's tremendous distrust of researchers in many, many communities. This first saying gives me goosebumps, but it comes from an Alaska Native. Researchers are like mosquitoes. They suck your blood and leave. And just recently, I was meeting with a community and academic partnership group, and a local reverend, very popular in our community, said researchers are the real undocumented workers. You come in, you grab our information, you go away with your PhD in your pocket or your new publication, and you never leave anything behind for the community. Well, that kind of distrust doesn't work well if our goal is to work with rather than on communities. Which isn't to say that we have to do gold standard CBPR where you're involving the community at every stage of the process to be authentic in the work. And I don't want to discount the important work going on in medical schools and elsewhere where you are working on an issue that you know to be important. There are still ways to engage communities so the work becomes more relevant to them, more meaningful, and that also ties in some of their concerns. I wanted to talk with you today about the value added for when we're doing community-engaged research, for building healthy environments. And Erin when she first talked to me about this, said, and be sure and talk about the disability community and the this community and the that community. So it got a little long, and I'm going to talk fast, but I am going to try to cover a wide range of issue areas and communities. But just to make the points about the value that this approach adds. And the first, I think, is helping ensure the relevance of the research topic. I suspect many of you are familiar with the work of West Harlem Environmental Action and their partnership with Columbia University. What you may not know is that this started 15 years ago, a long time ago, when the head of WEACT went to epidemiologists at Columbia and said, look, we are concerned in my community that 7 of the 8 diesel bus depots are located right in northern Manhattan. All of the Port Authority buses are there. We've got, at that time, 600,000 residents. Now it's up to 1.5 million, mostly Black and African American. And she said, we are convinced that the high rates of childhood asthma in Harlem are related to these environmental exposures. We want to study this. Would you partner with us? That's the ideal case. They come to you, they have an issue, and in this case, Patrick Kenny at Columbia was willing and able to partner. They developed a relationship where the community or the researcher was most focused on doing the studies and coming up with rigorous data on the relationship between community level environmental exposures and health outcomes. And the community partners, while they certainly wanted rigorous research, also said, we want to translate the findings into policy. We want to place at the policy table in the decision making. And they worked together on both of these. To make a very long story short, they got a number of outcomes, including getting the entire diesel fleet converted to clean diesel, which is sort of like being a little bit pregnant. It's not entirely where you want to go, but it's on the way, so it counts. They got tighter air quality standards that have withstood any number of legal appeals. And they adopted a statewide environmental justice policy, and Peggy Shepard, the head of WEACT, was the co-chair of that committee. So it's an example of a partnership that has continued for many years, continuing to work on that initial issue, but also now on indoor air pollution, on climate justice, which they call sustainability, a term I love. It doesn't have to take 15 years, though, and I did want to, again, give a shout out to the Clean Air Coalition here. After their own research had shown that they had high levels of particulates from diesel in their homes, they were able to do a rally and a march and get the state to agree to install air monitors within a week. So some of these victories come along very quickly when you have the good data, the community organizing, and you put them together with policy advocacy and work for change. Well, let's look at another way in which participatory research or community engaged research helps to improve our research and our outcomes, and that is in improving the cultural sensitivity and therefore the reliability and the validity of survey tools and any of the measurement tools that we're using. The example I want to share with you is one I've been intimately involved with over several years. This is a partnership between the Chinese Progressive Association in Chinatown, 2 universities, and the San Francisco Health Department. But our most important partner turned out to be the Chinatown restaurant workers that we hired and trained to work with us throughout this process. Most of them were monolingual Cantonese speakers, but they were incredibly committed to helping improve conditions in that community. Well, why restaurants? As you may know, restaurants employ about 1/3 of all the immigrant Chinese workers in the United States. They have among the highest rates of work-related illness and injury. So this seemed like a logical place to start, and we were pleased again that the community came to the university and wanted to do a study. And we designed with them an ecological approach. We were going to do surveys with, we were hoping for 400 workers to participate in detailed surveys. We ended up with 433, thanks to our incredible community surveyors who we also trained. We also developed an observational assessment tool that the health department could go in, because when health departments go into restaurants, they're only looking at health and safety from the perspective of you and me, the customers. They never look at worker health and safety. So we developed an instrument they could use to add on to what they already do, and use that in 106 of the 108 restaurants in Chinatown for the first time have data. And this is now shared on the website of the San Francisco Health Department and in an article in Public Health Report, so it's being used elsewhere as well. But I just wanted to give you an example with how in each of these cases, the community workers were the ones who really improved the instruments. In the first case, for example, this restaurant observational tool was going to include an item, are there first aid kits visible in your workplace? And they said, well, they're visible, but they don't have anything in them, or they only have Band-Aids. So why don't you see if they're fully stocked? And when we did that, sure enough, most of them were practically empty. On the survey instrument, we started as a template with a standard occupational health survey instrument. Very first page, they found a mistake. The Department of Labor lists all the categories of workers in restaurants, but they left out the leafleters. And I don't know if that's true here, but in our Chinatown and many others, you walk past and there's somebody going like this with leaflets to get you free dim sum or 10% off if you go inside, and they're doing that rain and shine. So why weren't they on the survey? They also help identify some of the concepts on validated scales that may make no sense in their community. For example, on the CESD scale that many of us use to measure anxiety and depression, never occurred to me that phrase, butterflies in your stomach, doesn't translate well into Chinese. And they were reading this over, they were laughing, and what's so funny? This is a serious instrument. And they told us. And so we talked about why you don't want to tear apart a validated scale, because you do want to be able to compare your findings with what are things that might be being found in Boston or New York or Los Angeles or Buffalo. But you also we need to figure out what's a phrase we can add below that ridiculous idiom so that it makes sense to people using the data. So that's the kind of way that they were very helpful in designing the research tool, but they also helped us in interpreting study findings, and I circled one of them. We came up with this figure that 42% of the workers had paid sick leave. And, we were surprised, we were pleased, but that was kind of a high figure. And the workers said, oh no, what that means is, in our community, when we have paid sick leave, what we mean by that is we can take a day off to be sick and come back and work a full extra day for free to make it back to the company. That's paid sick leave. So again, had we not had their help in interpreting the data, we would have had it completely wrong. Data collection also can be improved through ground truthing, which I know is a term Erin and some of you are familiar with and have used. But as you know, we often use secondary data analysis of government data sets, and we think this is a terrific idea, and it is, because when you can go to the state authorities or federal and say, and they question your data and say, but this is your data set. Well, it's kind of awkward for them. So you want to use secondary data analysis of government data, but on the other hand, you want to make sure that it's up to date and reasonably accurate. And so what a number of groups are doing around the country now is giving the data sets to community members who do the ground truthing. So for example, in this case, they're looking at the accuracy of information on air and water quality hazards and what are called sensitive receptor land uses, things like daycare centers and schools and parks. And then they locate and map additional air and water hazards and additional sensitive receptors that weren't there in the first place. And here's an example of one from Southern California where, as you can see, that the yellow crosses are air quality standards that the community found that were not on the original data. They're air quality hazards that that the community found that were not on the original data set. So it really does show how useful this method of community engagement can be. Another value of community engaged or CBPR research is that it can improve the cultural sensitivity of our interventions and thus the likelihood of success. And I'm sorry to use another California example here, but I think this is the one that, for my purposes, best illustrates this advantage. This was the Chamacos project. Some of you may know it's funded by NIH. It's been going on for 12 years now, I believe, and is up for renewal. And Chamacos stands for little kids in Spanish. So the cluster randomized controlled trial that they did was at strawberry farms, and they wanted to basically try to reduce the take-home exposure to pesticides in the children of farm workers. And they had a variety of ways of doing this, but two of the most important ways never would have succeeded had they not had community input in the beginning. They wanted to, for example, put water pumps up in the fields and just teach the workers to take time out before they eat and before they go home and at other times of day to wash their hands. And the community advisory board members said, well, you know, this is a good idea, but we Mexicans believe that if you wash your hands in cold water, you get arthritis. Who knew? So that meant that if this intervention was going to work, they had to put these water heating units in. And sure enough, when they did that, people started coming over. They didn't come over at every opportunity because you would lose a fair amount of your break time if you did, but they did come and use the facility in a way they would not have otherwise. And similarly, they wanted people to wear protective coveralls that they could take off at the end of the day before they went home and hugged their kids. And the women on the community advisory board said, that's a good idea, but we Mexican-American women are very modest, and we don't like our bums in the air when we bend over to pick the fruit. So if you give us a colorful shirt or a scarf to wear around our waist when we bend over, we will use the coveralls. And sure enough, as I mentioned, they got much higher use of the hand washing at the noon break and before going home. Almost everybody was using the coveralls. A big success in two interventions that otherwise would have failed. 12 years later, that program is still going on. As I mentioned, I'm involved with the training young people as environmental justice researchers and leaders. They're using photo voice and a variety of other methods to get the word out, to study both the assets and the problems in their community. They meet with principals at the school. They meet with the school board and the city council, and they've gotten some changes, and they've been able to do things like organize 5K runs in a community that does not have many sidewalks for exercise. So it's been a very exciting project, and that gave me an excuse to tie in the work here of the community, the Clean Air Coalition, and here's one of the members with a picture from their Photo Voice project, using these powerful images at a rally to demand more inspections at Tiawanda. Am I going to Tiawanda Coke. Okay. I didn't know about Tiawanda Coke until I started reading your work, and I still trip over it. Anyway, Photo Voice is, for those of you that are not familiar, it's a very effective method because you're not only giving people cameras and asking them to take pictures of problems in their community, but you're going through a process of asking questions like, what do you see in this picture? What's really happening? How does it relate to our lives? What can we do about it? And particularly with young people, using a method like that really gives them the power to look much more deeply at a problem that they've identified, look at the assets that might help in addressing it, and coming up with some solutions that they can then share with the powers that be. Another clear advantage of participatory engaged research is that it does build individual and community capacity. And I wanted to just share one global health example here. This is a work that's being done in both Guatemala and India, and the the ultimate concern was with indoor air quality and the fact that when you don't have stoves and people are cooking indoors, the diseases to which they know they have exposed, they've increased the prevalence of and the incidence of is just phenomenal. These are just some for which we have strong epidemiological data now. And so Kirk Smith and his team went in and tried to develop outdoor stoves or stoves with chimneys where people could cook and not have these high levels of exposure for them and their families. And it was very effective work. It's won all kinds of prizes. As you can see, there's a 91% reduction in exposure in the kitchens to all of these bad fine particulate matter. But at the same time, what they hadn't looked at until recently is the benefits for the community field workers who were involved in the study and who talked about gaining confianza, that not only were people in the community gaining confidence in them and feeling that this study really was one that cared about them, but the women were feeling confidence in their own ability to know a lot, be able to share it, be able to make change. Their health knowledge improved dramatically over the course of this intervention. They talk about the fact that they can now speak in public. They say, women come looking to me for advice. They improve their organizational skills, and it's interesting when they talk about organizational skills, they don't mean just having the clipboard and the pen, but having a stick for the stray aggressive dogs that they have to fight off as they go toward someone's house. So anyway, this has been a very successful project and one that again demonstrates a side benefit and one that many of us like to put more toward the middle, and that is improving community and individual capacity. Another thing I love about community-engaged research is that it does help with real-time dissemination and translation of research findings. And the example I wanted to use is in some ways quite similar to some of the work that's gone on here in upstate New York. West Oakland is an area with 25,000 residents, but it's also home to the Port of Oakland, which is one of the busiest in the country. It's home to the central post office for the whole region, and it's bounded on all sides by freeways. Well, not surprisingly, the asthma rate for kids is 7 times the state average. The West Oakland Environmental Indicators Project is a crazy name for a nonprofit, but that's their name. And they work with an academic think tank, the Pacific Institute, to learn all kinds of data gathering and measurement tools. So they've done very sophisticated air monitoring. They've also done truck counts, and I thought this was just standing on the corner counting trucks, and it's much more complicated than that. They've looked at idling of the trucks, and what they have found, again, using their data, is that the particulate matter from the trucks, in particular the trucks, is 90 times, their exposure is 90 times that of the state average. So they had very powerful data to share, and they did it, but they also disseminated and used the findings long before they appeared in academic journals to try to bring about change. So they published a report, and in it they talked about their goal, which was getting a truck ordinance, so the trucks would stop cutting through the neighborhood to get to the post office, to get to the port, and in the process polluting neighborhoods very, very badly. But they realized to do this, they couldn't just sit down among friends. They needed to include the truck drivers. They needed to include the Port of Oakland. And it was a case of real strange bedfellows, but they wisely got their city council representative to call the meetings once a month in her office, get all these diverse players in one place where they could talk together about what do we need to do if we're going to get everybody to agree on a truck route ordinance and then get it passed. They not only got it passed, they did something else with the findings that has been controversial with the Blue-Green Alliance. Some of the environmentalists were not all in favor of this, but the community partner wanted to use the findings to help convince the local Environmental Protection Agency and the Air Resources Board to support a $22 million program of retrofits and replacement of old buses Now, when you think about it, the bus drivers are themselves modest income. Most of them in our area are Indian or Pakistani. They don't have a lot of money to go out and buy the latest truck. But if you can retrofit the truck and make it a little safer for the environment, they're happy to do that. And it's estimated that this intervention is going to cut the emissions near the port by 85%. So, I think it's an important compromise. And again, it was done based on the data that they had collected. Now, Dennis Raphael likes to say if an article's published in Social Science and Medicine, but nobody reads it, does it exist? Of course it exists. And it is extremely important to publish findings in academic journals and where professionals, people in the field, and researchers can use and cite that data and help develop the evidence base that we need to get more funding for the kind of work that needs to happen. But I have to ask you, what would you think would have more impact? This article that came out in AJPH, or this one that came out in Oprah magazine and featured the head of the West Oakland project, who incidentally was a housekeeper, happened to come upon an article about diesel pollution in the wastebasket of a scientist whose house she was cleaning, asked if she could borrow it, became absolutely smitten, is a funny word, but she read everything she could find about this, became a self-taught environmental health leader, reached out to another organization, and Margaret Gordon just recently won the President Obama's Prize for Citizen Scientists. There were only 5 selected. Most of them were doing things like studying the migratory patterns of monarchs. And there's Margaret Gordon, only African American, and working on what I confess I think is a more important problem than the butterfly issue. Anyway, so, getting an Oprah is great. Most of us are never going to be in Oprah or People or anywhere else, probably for good reason. But there are other ways of getting the word out, and We Act is one of the best. When they got that initial data on the effects of diesel pollution on neighborhoods, they put up 75 bus shelter ads. They held an alternative fuel summit. They did a lot of briefings of officials and public testimony. They did press conferences, and they did toxic and treasure tours. And this, I think, is a really nice spin that Peggy Shepard added, because her point is you can take people around Harlem and say, here's this toxic release, here's this toxic incinerator, and here's this and yet another of the bus depots. And they can say, yeah, it's just what we thought, Harlem, and this is not as true now, thanks to Bill Clinton and others moving in, but Harlem's a dump, just as we thought. She says, and here's the Apollo Theater. Here's a national treasure. You don't have to be African American to know the importance of the Apollo Theater to the history of jazz in this country. So she makes a point of pointing out why these neighborhoods are so important and what they offer, not only Harlem in this case, but the whole country. Again, these kind of visuals showing and widely available on the web and elsewhere can put the data that you collectively gather in a form that is translatable to communities, to policymakers, to others that want to use it on the ground. Finally, the work we did in Chinatown resulted in many publications, but the most important was the one I forgot to bring to show you. It's called Check Please, and it is a glossy, short brochure that is in 3 different languages. We released it at an event, a press release. We had what I counted to be 21 members of the press. We had a room that was packed, 170 people, middle of Chinatown. And we had 4 of the 11 members of the Board of Supervisors at that meeting. The community used it to make a pitch on wage theft, a wage theft ordinance, which was their primary concern, and got action very quickly thereafter. And that's the last issue that I want to turn to, and I'm going to use several examples here just because I want to cover all the bases that Aaron told me to cover, but also because they're good examples of getting to policy. Now, as you know, we're often told that laws are like sausages. You don't want to see them being made. But in participatory research or community-engaged research, we not only have to watch, we have to be in there getting our hands dirty. And there are some academics that feel we lose our credibility as scientists when we do this. I believe you can still do strong science and stay around for the long haul so that you are helping with the translation and use for findings. This is a model I like very much. It's by John Kingdon, a political scientist, who talks about the three streams in the policy-making process and how we have a role to play at each stream in the process. So we need to convince the decision makers that there's a problem in the first place. We need to get on their agenda. We need to come up with feasible, workable solutions. And in this day and age, that means, of course, we don't have a government, so I guess we can't come up with anything for a few days, but you know, is what you're proposing going to be cost neutral, cost savings ideally, or cost effective? Can you show that? And finally, how do you negotiate the politics that get approval for your measure? Well, here's an example from Old Town National City, which was a vibrant heart of the Latino community in Southern California. An all-white city council in the 60s decided to change it to a mixed-use neighborhood. All the truck painters and the car detailers, I don't know this world of cars and trucks, but they moved in. It became a very unhealthy environment in which to live. And the pink triangle there is the local elementary school, surrounded by these toxic industries. And the Merrimack's Momax is a truck driving school right opposite the elementary school. And what they actually were doing was driving into the schoolyard during school hours to practice idling, turning, etc., and come out again. And the teachers, the kids already had high asthma rates. New teachers were finding that they were developing asthma. It was a crazy and just immoral situation. Well, I use this example because it's a terrific example of community-engaged research on several levels. The in-house, the Environmental Health Coalition, which kind of ran the show, did their own in-house data collection. They had one epidemiology MPH person, not a high-level postdoc or anything else. You don't need that kind of education to develop, as she did, toxic footprints, showing, using GIS data, how much exposure to the toxic emissions people in Old Town were experiencing compared to the footprints just a few feet in some cases and miles away. The outside research partners at USC were not only helping translate their findings about things like the effects of diesel exposure on lung development in young kids, but they were also doing data gathering for the local communities on local particulate matter. They weren't getting money for this, they were just doing it to be helpful. But the community members were also being trained to do ultrafine particulate matter monitoring, to do survey research, and they did surveys and collected data in a variety of ways that was very useful. And they also got qualitative findings that they could use in when they were standing up in hearings. They got a lot of media advocacy, and that, of course, is when you're getting the media to cover a story from your point of view, from the community's point of view, from public health or medicine's point of view, and not from the sensationalistic individual case study kind of thing that they often like to do. So they became masters of media and policy advocacy, and these are just three of the outcomes for which the Community-Engaged Research Partnership was given a lot of credit. They got the passage of an amortization ordinance, which gave businesses that were polluting a limited amount of time to get out of town. They became the first city in California to make environmental justice part of their general plan, and then 3 years ago passed a specific plan that included relocating all of the polluting businesses to an industrial area outside the neighborhood. So it's a real success story, and one that, again, shows how these different partners coming together can help make a difference. Okay, I wanted to also share an example from the disability community, because when we talk about community, we're not always talking geographic. And the disability community, in my experience, is one of the most effective in their use of community-engaged research. Now, when we talk about disability, we often think of placards and curb cuts and all of that, which is tremendously important and took a lot of work on the disability community's part to get passed. But they're doing so much more than that. And I wanted to share an example from Chicago that has really impressed me. As some of you may know, the Supreme Court made the Olmstead decision back in the, I believe it was in the early 1990s, that states have to provide services in the most integrated settings possible. So you don't want people in nursing homes if they don't have to be. Most states have been moving in that direction anyway. Old people, disabled people want to stay in age in place, as it's called. But Illinois is one of the outliers, and the percent of people with disabilities, even those under 60, was still increasing in the early to mid 2000s. 80% of the state's money for disability and long-term care was going to nursing homes. That's just the opposite of most states who have turned this around, realized nursing homes just are not for this population where you want to be. So moving out of the nursing home and into the community was the name of the project developed by two Centers for Independent Living working with the Rehab and Disability Studies Department at the University of Illinois in Chicago. And I went and visited and was tremendously impressed with their work and did a multi-method analysis with a research team to be able to showcase it. And we always put the community members' names on the publications if they so desire, because it is another way of helping give visibility to their work. But they did a randomized control trial. The intervention was this so-called stepping stones intervention, where people would get a 5-week training. They would develop individual and life skills, community life skills, and capacity building. So things like learning to use a computer. They also put a heavy emphasis on advocacy and systems change to rebalance long-term care in the state. The people that I spoke to, the people with disabilities who were coming out of nursing homes, called themselves escapees and survivors. Some of them had been homeless and were picked up in the middle of the night and offered a clean room, clean place to stay and a hot meal. They woke up the next morning in a nursing home, and it took them on average 2 years to get out. People don't even know that this is happening, but nursing homes short beds are doing this in some places like Chicago to get people. The research was very rigorous, as I said, randomized controlled trial. They started out with focus groups to help figure out what the intervention needed to look like, what they needed to collect data on. They had a huge baseline survey, repeated measures. They also did qualitative narrative life interviews, and they did follow-up focus groups. So a tremendous amount of data gathering, and all throughout they would hold community forums. I attended several of these where the community members who participated or who were just interested would come and talk about the findings and give their interpretations, give ideas for going forward. Outcomes, by midpoint in this study, 37% of the participants had transitioned out of nursing homes compared to just 20% of the controls, and many of them were becoming very profound, effective advocates, telling their story, helping change the long-term care picture in Illinois. And these are some recent changes on the systems level. The Money Follows the Person program, $53 million available now for people who want to move to a home environment or a community-based environment and do not lose money because they're leaving a nursing home. Energy backup attendance services for the weekend. You don't think about this, but if your caseworker, your home health aide becomes sick or wants to go and visit her sister on a weekend and you can't get attendance services, you go to a nursing home. So this is another way of getting emergency backup to keep people in their homes. And they also did a community reintegration program for people over 60. So lots of work going on in the disability community, very effective community engaged work. And if that's an area you're interested in, you might want to think about partnering with a local community for independent living. I also wanted to throw in another example of a way that community engaged research is going on around the world now, and that is in slum settlements with the slum mapping movement. And I've been terrifically impressed by this. There will be sessions at APHA if you want to learn more, and if you're going to that meeting in Boston. But basically, this is a movement that started in India about 10 years ago. It has spread throughout much of the many low-resource countries, and particularly in Africa. And let's see, I can no longer see the screen, so I'm hoping these are all showing up. This is a resident of the largest slum settlement in Nairobi, Kenya, 200 people. And he's holding a handheld device and is able to help map his community. And let me show you why this is so important. If you Google that settlement, you see a big green plot of land. You see a few structures, it's hard to tell what they are, and that's it. This is what they came up with. You can see, among other things, the tremendous density of housing and other structures there. But they've also indicated where there are toilets, where there are businesses, any other kinds of land uses. And why this matters is that you can provide evidence in court. Some of these folks, of course, are evicted. If you have done the mapping, you can say, this is my home, this is where I live, and it's on a map, and it's held up in court when they've been able to fight evictions. They've also been able to pressure officials for services like getting a water main into this huge area, getting more toilets and streetlights, and when they do that work, they often have to ask residents, if they're going to put in a water main, for example, would you move your shanty a few feet back so we can get through? And people are scared to death they'll never get their land back. This way you have proof of place. You can show this is where I live, and after the water main goes through, you can move back to your full space. So again, it's hard for us living in places like Buffalo and Berkeley to even relate to this measure of injustice, but it does exist, and fortunately we have some tools now that are helping people to deal with it. This is an example I wanted to share because it's one of my favorite. It comes from a collaboration between Literacy for Environmental Justice, which is a real youth-driven organization in San Francisco, with the local health department, partly using tobacco-free money, which we can easily get for our work, provided there's some component of a focus on tobacco. And here's what they wanted to deal with. When I think of neighborhoods like Bayview, Hunters Point, Harlem, Cook County, Chicago, the top issue that people often come up with when you ask them about problems is crime and victimization. But if you keep going, usually second or third in the list of priorities is lack of access to healthy food. This happened recently in the Tenderloin in San Francisco where I'm working. It happened in Bayview, Hunters Point. And everybody was surprised. They said, Bayview, Hunters Point, they're one of the murder capitals of the world. They've got some of the worst pollution, but they also don't have access to healthy food, and that's what they really care about and wanted to work on. Well, they used a variety of research methods, and again, finding methods that young people could use. And this is the one I love. This is a very simple technique, and it's something that you and I as adults normally can't do. We cannot go into a local mom and pop liquor store or glorified grocery store and say, excuse me, I have my tape measure here. I just want to see how much of your shelf space is being used for alcohol and tobacco and other products. No, it doesn't work. But if you can say, I'm doing a class project, can I come in? They will let you. So the young people in this project went in, they got into 11 of the 13 corner stores in Bayview, and this is a neighborhood with no full-serve grocery store. And this is what they found. Almost 40% of the space was for packaged food, 26% for alcohol and tobacco, 17% for basically sodas, although it's supposedly other drinks as well, and just 2% for fresh fruits and vegetables. That hit the paper. That was a very important finding. They also did GIS mapping. They did merchant interviews, interviews of the local residents, and they found out that it takes people an average of 3 buses in 1 hour to get to the closest full-serve grocery store, which is outside their community. So they were at that time taking $2 million worth of tax revenue out of the community every year. Now it's probably double or triple that. This was a few years ago. They also showed that 25% of residents eat fast food every day, and it's not necessarily because they want to eat fast food. That is what's available in their community. So they hatched a plan. They got together some partners in and out of government. This woman dressed as a cluster of grapes is the local supervisor. It's always smart to get your political people, policy mentors, as they're called, on board early, so they will be behind you. But they brought them together and talked about their plan for developing what they called a Good Neighbor program. And the idea is, if these stores will commit to having at least 10% of their space go to healthy food and taking down some of the alcohol and tobacco ads and having far less space for those kinds of products, the city would offer some things. They would have free branding. They'd put up these colorful ads showing that this is the place you want to shop. They would give them a discount on energy-efficient appliances and so forth. Here you see 2 of the ads, and these incidentally won awards. They were done by a advertising specialist who volunteered his time and won an award for the ads that now appear throughout the Bayview, showing people which stores they want to patronize, which ones care about their health. This is one of my attempts to do a colorful PowerPoint, but what I wanted to show you is in the pilot store, the percent change in sale just over the first 7 months. Produce went from 5 to 15% of total sales. Alcohol and tobacco both fell by about 10%. 4 years later, the picture was similar. I was back there 2 years ago. The produce sales were up to 17%. And the owner of the store was joking with me and saying, I don't know what I'm going to do. I've got to start selling a few cigarettes again. But people were not coming in particularly to buy liquor. And I wondered if anyone could guess why that might be the case. When you've changed the way the store looks and you've got more fresh fruits and vegetables and you don't have all the ads up, why would people who normally go there to buy alcohol not be doing so? Yes. Social pressure, and there's one particular person you don't want to have see you there. Your mom, your grandma, yeah. I'm going somewhere else, or I'm not going to be buying. I just don't want to be seen there. And what they found was, for example, in this neighborhood, a lot of the Latinos started coming to the store, so they stocked tortillas and things because they wanted the fresh fruits and vegetables. But among the African-American community as well, you had more families coming in, and so single men, primarily men who wanted just alcohol and tobacco, were not going into the stores anymore. This was such a powerful example. 4 more stores converted to become healthy stores. They got a truck, so at the end of the day, if there was leftover healthy food, they could bring it to the local schools or to the homebound people. 5 more stores were about to convert, and then the recession hit, and I can't overstate, as you all know, the importance of a contextual factor like a giant recession in really hurting some of these projects. They had to, the Literacy for Environmental Justice had to pull out for a while and just regroup and try and save themselves. And meanwhile, they continued going forward. The Southeast Food Access Group is a wonderful organization with food guardians who work on not only improving stores, but doing education and awareness in the schools. They do urban agriculture. We've now got beautiful gardens with fresh fruits and vegetables in the Bayview. And the whole program was so successful that it's being replicated in the Tenderloin, which is an area of San Francisco that has 270 tobacco outlets compared to about 5 in the area, the other areas where richer people live. So they did their own shopping guide, and again, we just passed this September an ordinance for a healthy food program for the whole city, but we're testing it first in the Tenderloin. Now you've got to have 35% of your shelf space going to healthy food, less than 20% to tobacco and alcohol, and you get a number of benefits, and the city is now providing these. So I also wanted to mention the importance of public-private partnerships and new opportunities, and I am not up to speed on this. I couldn't find enough on the web, so I put a question mark there, but I think the fact that the Clean Air Coalition got the EPA and the DC to partner with them around air pollution and got this 3E program going where they're working on energy and pollution audits and showing companies how they can reduce emissions and also partnering them with funders who may be willing to help pay for some of what needs to be done is a very effective way to go. So I'm hoping that we'll maybe at the end of this, which is coming up soon, we can get some more information, or I don't know if Aaron or anyone else has a quick update on this.
We're waiting to see what comes out of it, but I think it took a lot of work to get that partnership up and running. Jim Jones from the town is here as a partner too.
Oh, great.
So yeah.
Okay, good. Well, I was real impressed by this, so I hope you succeed. Okay, truth in advertising. Am I way over time? Where are we? I'm fine.
Yeah, it's only 10:15.
Okay, translated into minutes.
45 minutes. You got till 11 o'clock, right?
Oh, well, I won't talk that long. I wanted to have plenty of room for discussion. So let's just talk briefly about some of the challenges and obstacles in this work and then open up for discussion. One of the big things I'm concerned about is what happens to community partners who get involved with us outsiders and sometimes talk about, Paulo Freire said, becoming strangers in their own community. What happens when promotoras who are working with us get labeled chismosas, gossips? One of the women that we met with in Old Town National City said, I try and do this work, and an older woman comes up to me and says, I've been in this community 30 years. What makes you think you can change anything if I've never been able to? Husbands getting very jealous, and boyfriends saying, why are you out at night supposedly going to a meeting? How do I know what's going on? In this case, the head of the Environmental Justice Committee, who was a white male, realized there was a problem, and he took all of the men, partners and husbands out for beer and said, look, I got a girlfriend. I'm not interested in your wives, even though they're lovely women. And I really want you to be proud of them because they're doing very important work. And some of those men started coming to the hearings and kind of puffing up when their wife would be quoted in the paper. So it was an important thing to do, but we forget. And we also sometimes may have community partners do what I call the project dirty work. An example, if you're doing some kind of a randomized trial and you have a staggered design, and some people aren't going to get the intervention until 18 months later, and the community's excited because they think this is an important healthy homes intervention or whatever else it is, and they're furious that they have to wait that long. You send the community partner to deal with that. Seattle did this, and they freely talk about it, so I'm not telling tales out of school, but they had a great partnership, but then they sent the community in to deal with the unhappy residents in the control group. And I think we need to be there. When things are going to be rough or have a potential to be, we need to be there too, right next to the community partners. We need to take the heat and not leave it for them. This is a term that comes from two community psychologists, and I think it really defines things well, that in community engaged research, there's often this balancing act between what's called the necessary skepticism of science and the action imperative of the community. So the community, we get our preliminary data, the community said that, great, let's call a press conference, let's use this, let's go to the policymakers, and the academics are saying, well, wait a minute, we got to make sure the data are clean, and we got to do this, and we got to do that, and there's this tug of war that sometimes goes on, and that's something we need to be able to deal with. One thing I like to do is have memoranda of understanding with community partners ahead of time, where we all put out on the table what our issues are and figure out ways of dealing with them and ask the hard questions. And one of those questions is, what do we do if findings emerge that may cast the community in an unflattering light? You know, we often don't think about this, but if something comes up that could be a problem, are we going to publish that finding? If we hold it back, are we doing good science? I always tell people in publishing straight academic work, we don't publish everything we find. If we have some findings that aren't significant and aren't interesting and particularly important, we don't publish them. So to have the community have some role in saying, okay, this finding, you know, would do some harm to us, and maybe you've got plenty of other good findings, maybe that one we don't need to publish. That would be an interesting discussion for us to have. I had that discussion with my dean at the time, and it's an important one. The insider-outsider tensions that arise even when we've got great relationships. Nina Wallerstein worked for years with Native American tribes. She was beloved. She was almost taken in as one of them. But then she came in a role of an evaluator for a state project, and she said, you know, she had no idea about the power of the authority of the often multiple unspoken privileges that she represented as a white woman with a PhD, even as somebody who had all these deep friendships. So we need to be aware of this, and we need to, I think one of the best things we can do is help bring grants in that come to the community partner where they can then subcontract to us. We got, for the Chinatown grant, we got a grant from the CDC that funded most of the work, but didn't have enough money for the amount of translation, the amount of community capacity building we wanted to do, and so we immediately wrote a separate foundation grant for an even larger amount of money, which we brought in, which went straight to the community, and that was a way of showing them that we value their contributions and desperately need their participation. But there are differential reward structures. There are conflicting timetables on both sides. We may need to get a grant in, and I can't remember who was looking at the announcement about the curtailment of government saying, don't bother sending your grants in right now. We have nobody to deal with them and review them. So, but normally we're on a timetable. We got to get the grant in. We got to meet our timeline. But communities too. In the Chinatown project, I remember we finally got through human subjects and we're ready to go. And they say, oh, we got to wait 3 months because this is an election year and we're doing all this work to get a Chinese mayor elected and to get these supervisors reelected. So we can't work for 3 months. And you know, you have to take that into account, and you have to plan in advance for things going wrong if they will. This is an example that I think is extremely dramatic, probably too dramatic to use, but I threw it in anyway. The real clash between concerns of the community and what for us academics is good science. This was a study, Tribal Efforts Against Lead, to look at the very high blood lead levels in Native American children in Oklahoma, in this particular area where the streams are actually bright red from lead. It's just, it looks like a massive murder scene, and it's the lead content. They wanted to evaluate a lay health worker model to reduce exposure. They had an RCT. All was looking very good. And this, incidentally, is the area I'm talking about, Tar Creek, where they have 75 tons of mine tailings, the leftover lead from when the lead and zinc mining was happening to a huge extent. It kind of stopped in the 70s, but this was a major area where that was happening, mostly in Indian country, and because it was such a resource-poor environment, they were using the leftover lead in roads, in buildings. People were sliding down. They were making mountains and sliding down the lead mountains. It was getting into kids' sandboxes. So it was a really terrible situation from an environmental health perspective. And the lead, the PI on the project, wanted to use white children as a control in this study, and had 40 Native American community partners from 8 different tribes. They'd been trained as community clan mothers and fathers. They were fully involved in the project, and they said no. They said, we have been excluded so many times because we're Native American. We do not want to be part of a study that's going to exclude white kids. And I talked to this PI, and she said, you know, this really weakens the study design, but they're absolutely right. From an ethical point of view, knowing how serious this problem is, we shouldn't be excluding white kids. So they ended up including all of them. The data were so powerful, it didn't matter that they didn't have the control group. They had very, very impressive data and before-after changes. And sadly, the fact that white kids were included increased the political punch of the data when they wanted to use it. And that is a sad commentary on our society, but it did work to their advantage. IRBs, don't get me started. They are very reluctant to oversee community partners. They were never designed with our kind of research in mind. I recently finished a study of late-stage diagnosis of HIV among African Americans and Latinos. It took us 9 months to get approval. Chinatown, it took a year. And this was, never mind, it just a very painful process. But, you know, that meant we only got half the money. We could only do certain things, and the project went over, you know, no-cost extension for, I think, 2 years to be able to finish what we were supposed to. So ideally, you want people like some of you who are interested in this and have the time to volunteer to be on the IRB committee. I spoke to all the IRB people they have an annual meeting, and they asked me to come and speak about CBPR. And there are places like University of Indiana and Portland State that have special IRBs that deal with CBPR and know what our issues are. And, you know, we still have to be careful of individual risk and benefit and so forth, but we also are looking at community issues, and they're looking at this in a different way, realizing we work in a different way. But many of us haven't volunteered for that role, and that's a problem. I've noticed that community partners often share the fears of academic partners about the translational piece of this work. When you talk about doing policy advocacy, trying to get new legislation, they say, oh, we can't do that, we'll lose our funding. This guy, Gary Grant, some of you may know, he's the leader of a group called Concerned Citizens of Tillery, North Carolina, which has gone after the rapid proliferation of industrial hog operations in that part of the country where they have more hogs than people. And he's been on 60 Minutes 3 times. And yet, when I ask him about his role and his partnership's role in influencing policy, he said, oh, we don't do policy, we just educate legislators. So people are learning to talk the talk, but when you're trying to evaluate and show that your partnership's work made a difference, it's awkward when people are afraid of talking about the role that their group and their partnership may have played. And some academics are often discouraged from doing any kind of advocacy work, and some of our journals encourage this. This was a statement out of the journal Epidemiology that says if you have policy recommendations, put them in a commentary, put them in a letter to the editor, but don't put them at the end of your paper. Well, to me, that is not a place where we should be publishing our work, because if we're not coming forward with policy or other recommendations for change, we're not doing our job as community engaged researchers. However, and I brought a hard copy of this we can make for those of you who want it, these are all the journals that do publish CBPR, and many of them are high-impact journals, and this is 2 years old, so the number has probably increased dramatically since then, but I would not worry about doing this work out of fear that you can't get published, because that's certainly not the case. Finally, something I think it's very important to remember is that even though we have free speech and everything else in this country, there are groups that can get penalized, that can be deported, and I really feel we need to be careful and talk with partners if we're going to be doing some of the kind of organizing that the Clean Air Coalition does, and part of it is going out there and getting your face with a placard in front of the media and going before legislatures. Are you going to be putting people at risk? Are they going to be putting themselves at risk? We need to talk about this and make sure. And Aaron's, I don't know, one of you may want to make a comment about that. Okay, so despite the messiness, despite the difficult challenges that we face, I do believe that if we're trying to build healthier environments in all different senses of that word, CBPR does have a lot to average it in. My friend Rachel Morella-Frosch talks about the 3 R's of research: the relevance, rigor, and reach. And I think community engagement helps improve all 3 of those. It certainly helps build transparency, respectful partnership, and it builds community capacity. And lastly, I just want to share my favorite quote. Oh, sorry, I missed one. It does contribute to distributive justice, which many of us talk about, but also procedural justice, where, and I just define that as increasing and in ensuring that community members get a seat at the table and stay at the table to help make the decisions that impact on their lives and the lives of their community. And that's a very important part of this work. And finally, here's my last quote from a dear friend who recently passed away, Frank Rose, a wonderful community partner, who said, "I don't think outside the box, I think outside the warehouse." And I think CBPR and community-engaged research offer an opportunity for thinking outside the warehouse, because we're partnering with people whose communities are impacted by issues that we may not personally be confronting, or certainly not on the level that they are. They're in a position to help us really think outside the warehouse. They are already thinking outside the warehouse in terms of how we can address these issues and what kinds of information and data we need. And the data may be lay information, it may be stories as well as figures and statistics. But I do think CBPR can help us in thinking in a new way that in turn can better help us not only collect good data, but then translate it and use it to help bring about health and social equity. Thank you very much. Okay, do we have time for questions? I think that's a good question. He was asking what attracted policymakers to something like the Good Neighbor program so that they would actually give up city resources to be supportive. Part of the trick, I think, is to get them involved in the very beginning. Some of them work in districts where food insecurity is a big issue and they're personally concerned about it, and that was the case of the supervisor wearing the grapes. She really deeply cared about this, and when she learned that her community wanted to do something, she was full bore there. San Francisco, of course, is always an exception, and I like to do studies outside San Francisco because people can say, oh, that's the left coast. I mean, get real. But, you know, similar kinds of things have taken place in Argentine, Kansas, for example, and they similarly were able to get a change and work on this issue of being a food desert. And it didn't take city involvement, but it could have. They got all of the 13 block associations, neighborhood tenant associations on their side. That in itself was a powerful coalition to then go to politicians and say, we want your help on this. So I think going to them first is ideal, But even otherwise, when you begin to build momentum, as the Clean Air Coalition has, you then have you have the potential for great impact. Yeah, no, that's very, very good question. One of the other issues you didn't mention is that with the cutbacks to many of our universities, our fiscal management staff has gone down to practically nothing. I have one project I run that involves 80 community residents, mostly from underserved communities, and they'll be turning in their receipts for their bus trip or their, whatever, and it takes months, and they're calling and saying, where's my money? And these are people that desperately need that money. So some universities are allowing us now to contract, to go through another entity that's not as heavily impacted. That isn't the case at Berkeley. We get in trouble when we try that. But I think when universities see, and they often will come to a project like any of these that I've mentioned, they'll want to put that in their alumni magazine because it brings them, they can say, we're relevant to Buffalo because we're doing this and we're doing that and we're with the Clean Air Coalition. So they want that, and I think the payback needs to be, okay, you need to also get across to the IRB and to the fiscal management folks at UB that this is an important part of our work. We have our last chancellor set up a Chancellor's Award for Research in the Public Interest, which is not entirely community-engaged research, but it has been a way of getting top-level recognition for the work of people who do this on the campus. So that's something. If you can get high-level people on your campus to support this in whatever way, that too is important. But I think you're right, and I think a lot of this also has to do with educating the IRB. And when you do that, they'll be receptive to the education, and then they'll ask you to be on. So you have to have somebody who's got the time and interest to be on that's a good point. He was asking if we have evidence showing the community and individual capacity making outcomes from these projects. There are some that are written up and published. I've encouraged people to publish more about this. I believe Barbara Israel and the group in Detroit that have the village health workers who have been active for years, they have written up the impacts for the women. And just even I did a participatory evaluation of the Healthy Start program to reduce infant mortality. And in one of those sites, and this is written up, one of the most successful sites, we were looking at the community involvement component of the Healthy Start program. One of the most effective sites was Harlem, where 80% of the women who were experiencing low birth weight or losing babies were telling us we have been abused, and domestic violence is a big overlooked factor in infant mortality. Well, 20 women were hired and trained as domestic violence peer educators. They did their own video to help with the education. They also did job training for 100 of the women. 80% of them got full or part-time jobs. That's all documented, and what we also documented is that the drop in infant mortality in Harlem was 273% over 13 years. So it went from 28 deaths per 100,000 live births to 7, which is much more, it's still 7 babies you don't want to lose, but it's a much more acceptable, if you will, level. So you can find those usually in an article on CBPR. There's some mention of the impacts in terms of community capacity building, but not as much as we need. So I do urge people to write up that part of the work as well. Right. And what I tell people is keep your day job. In other words, doesn't have to be your grant, be on somebody else's grant that's more traditional, that's faster timetable, where you're going to be on some publications that show that you can do other forms of research. At the same time, you can do studies from the very beginning. You can do publications from the very beginning of this. We did an early paper on the Chinatown project, on the beginning of the project. Mary Northridge, who's the editor of American Journal of Public Health, wrote about the beginnings of this, what is now 16, I think, year-old project between Columbia and West Harlem Environmental Action, and wrote about the challenges getting started. You can write a paper on ethical challenges that come up in the work. And these high-impact journals, Social Science and Medicine, whoops, glad that wasn't the water. Anyway, high-impact journals publish those kinds of articles because they get cited often. They're assigned in classes, people are using them, and every time they're cited, their impact factor goes up. So I think you can do the work. I wouldn't do it exclusively as an untenured person because it does take more time and you do need to be getting the publications out. But if you've got something else on the side that you're a part of, you can do this and you can know that you will be getting publications out at a very early stage. I was reading proofs on the plane, the HIV study that I mentioned on late stage diagnosis. One of the first things we did was develop a partnership covenant, and it was our principles of engagement, and we wrote an article about how we developed the covenant, how we lived, how we went back and used it as a measurement tool to evaluate how well we were doing. And we give some examples of failures and of some examples of things that went well. Well, that's a publication, and that has come out long before the ultimate HIV findings from the study. So I think there are many ways of making this work and turning things into pubs. Yeah, I believe they are. I haven't found that to be a problem. Yeah. Oh, I'm sorry. She was asking if NIH is more receptive to paying community partners for their time, and I think they definitely are. Roughly half of the NIH divisions now will either call for community-engaged research or suggest it as a strategy. And so I think there's some that I wouldn't bother. I mean, the Institute on Aging still has never had a call where they've used the words. I think they have a little gerontophobia going on in NIA. But most of those that do are absolutely into paying. And I'll tell you one very positive story. The way I got involved in that HIV study is that the Office of AIDS in NIH decided they wanted to fund this $1 million proposal to look at late-stage diagnosis, but they called the PI and said, you're never going to get this kind of information unless you go in using participatory research. So bring somebody on board who can rewrite the proposal so that it's CBPR, and then we will give you your money. And it became a CBPR study. I'm working on a grant now for NIHS, and I was told that we could call 2 of these people, one of whom was a farm worker who became so involved in this project that he's become integral to it, and we're calling him key personnel, and we're calling him the lead community partner.
Now, are you paying him as an employee of your institution?
We're giving a subcontract to his organization.
Okay.
Yeah, but I've also,
Organization, is it not?
it's a clinica, it's a community clinic. Yeah, but we have also put them on our grant as key personnel, and it's becoming easier because NIH is getting it. IOM came out in 2003 and said CBPR is one of 8 new content areas that all schools of public health should be teaching, along with genomics and the other areas. So I think NIH is much more receptive than people realize. I found, and I don't believe I have it with me, there's a phrase in the Federal Register about confidentiality to the extent that it's realistic. And you can quote that and be able to show that in this case, very often people, incidentally, if you're doing a photo voice project or some other kind of qualitative research, people like to have their identity known. In fact, we've had people insist that their name be placed anywhere we show the picture of that they took. They want their name there. They want to be recognized. And I think if it's explained in the IRB application, there are ways of getting around that. And also, we were told in some cases, talk about confidentiality to the extent possible, but that total anonymity is not possible in this case, and the community partners understand that. Okay. You know, even the business community is getting behind this in a strange way. I just got asked to write a chapter, and I didn't even respond to the email because it was from the Federal Reserve Board, and a bank, Federal Reserve. And I just thought more junk mail. And then somebody called me and said, didn't you get that message from the Federal Reserve? They're putting out a second book on, this one is on community, in making data more relevant for policy, and they wanted a chapter on community engaged research. So they were asking me to write it, and I thought, gee, the Federal Reserve, who knew? But the business community is getting interested in this partly because they want to see changes. They don't benefit when a third of our African American and 40% of our Latino kids aren't getting high school diplomas. It doesn't help business. So they're seeing that some of this kind of work that can make a difference in education and workforce development is very important. And I'm always impressed with the public-private partnerships, and maybe one of you could speak to the public-private partnership that you're hoping to develop if that's appropriate.